For many months now, we've been hearing the non-stop mantra about how we have to listen to the experts, do exactly what they say. If the public health officials tell us to jump, we have to respond by asking, how high? And don't you dare even ask a follow-up question or you're a this or a that. You get a lot of blowback. Well, sorry, I've never bought that. I've always felt that it's important to ask a bit of follow-ups. Ask, okay, well, thanks for these public health edicts, these restrictions you've brought into our lives, but, and we think this increasingly as we get into the second wave, why exactly are we doing this? Why exactly are we doing that? Trick-or-treating, ban, really? You say it's not safe? Can we probe that a little bit? Can we talk it out a little bit more? Well, I feel of that view that there is a need to at least get a second opinion from what a lot of our health officials are saying after I read a rather shocking report by Dr. Theresa Tam that came out on Wednesday where, well, she does her annual report and it is on the pandemic. So one goes, okay, great, maybe she's going to help us understand what type of different vaccine options we may be facing, in what way we're going to be grappling with this virus in the months to come. Are we going to have these rolling lockdowns? Is that what they're pushing for? Or are we going to chart a path forward? Can we do individual risk assessments, risk profiles, talking about, okay, let's work towards protecting the more vulnerable out there, really putting all the resources to them, but letting low-risk people go out and live their lives a bit more. Some sort of game plan, some sort of strategy. Reasonable for me to think that maybe I'd hear that sort of stuff in that report, right? I was looking forward to it, genuinely. What's the path forward? What are the next steps? Let's talk it all out. I was open-minded. Then I read this document. Very bizarre, very troubling, Dr. Tam's annual report that has nothing of what I just spoke about. Very little actually directly to do with the pandemic. What it actually is looking at the pandemic from an equity lens. That's actually part of the subtitle of the report. The introduction, the conclusion, a lot of the guiding principles are all about, okay, let's look at the pandemic through ageism, ableism, racism, intersectionality, all these sort of buzzwords that you hear from academic progressivism. Dr. Tam says this opportunity now is for us to revise the way we live, the way we work, and the big challenges we have to do is tackling environmental issues, housing support programs for people, reform the Canadian agricultural system. Yes, that's true. Okay, if you're interested in those things that she said, well, so be it. And quite frankly, I think if Dr. Tam was running to be leader of the federal NDP, the document that she drafted, that would actually be a pretty good campaign platform to run for that leadership. If that is what she seeks to do with her life, I wish her all the best. Go ahead and do it. It does not seem a very appropriate document, though, for Canada's top public health official to release, supposedly, about a conversation about the pandemic. No insights, no answers to those questions that folks of all walks of life have been asking about what to do to really get out of this dark chapter in our lives right now. No one wants to be in this situation. Surely there must be a better way. More and more business leaders, associations, groups stepping forward, asking those questions that we're kind of discouraged from asking about, well, can we do it this way instead or that way? Can we see the facts, the evidence backing up why, gyms are closed or this location are closed? All of these points that are being discussed by everyone, except for public health officials. So by all means, we go with the science, the data, the evidence. I support all of those phrases. I just wish that was actually being done by Dr. Theresa Tam.